And welcome to the Healthbeat Show. I'm Dr. Jeffrey Watson. We have an excellent show for you here today. A lot of times you will hear me say that the Healthbeat Show discusses issues from your nose all the way down to your toes. Today we're going to be talking some about your toes, about your feet. Today I have with me none other than one of the top foot physicians in the United States, and that is in none other than Dr. Alex Raiselman. Welcome to the Healthbeat Show, Dr. Raiselman.
Thank you, Dr. Watson. Pleasure to be here.
We're so honored that you would be here. You know, off air, I was talking about the work that you do. I said that I make no reservation that Dr. Raiselman is a foot physician for limb preservation. Limb preservation. So you're a foot physician. Tell us a little bit about yourself. That would be called a podiatrist.
That's
Tell
correct.
us a little bit about your background, your training, where you're from.
Okay. I'm a podiatric surgeon. I grew up in San Francisco Bay Area. I went to California School of Podiatric Medicine. And then I went on to do my surgical training at University of Texas Health Science Center at San Antonio, where I spent 3 years. And some people feel that San Antonio is the mecca for diabetes care because it's the southern tip of Texas. A lot of patients with diabetes. And when I came back to San Francisco, this is where I really found my passion to be able to treat and manage patients with diabetes and lower extremity complications.
And now I understand that after the training that you've done, you're giving back. You are a professor at several institutions. You teach medical students in the School of Podiatric Medicine and residents. Tell us a little bit about that.
I'm fortunate to be able to give back because when I came back to the Bay Area, I was hired by California School of Podiatric Medicine to teach their limb salvage wound healing course for the podiatric medical students. And then that evolved into training residents from Veterans Hospital in San Francisco at UCSF, and further led on to having students come with me in my clinic and being able to train them, seeing real patients on daily situations.
Mm-hmm. And that's so important. You know, nowadays we have so much in the way of diabetes, and that's an area. Here's a foot doctor that goes to the area of diabetes. Now, why is it that one of the key things that they teach internal medicine doctors, it's a quality measure actually, is has a diabetic had their foot checked? What's the role and the relationship between diabetes and the feet?
It's a very important question, but let me share with you some of the statistics. There are approximately 29 million people with diabetes in the United States alone, over 300 million worldwide.
Wow.
The projection is that from 2007 to 2025, we'll at least double the prevalence of diabetes, not only in the U.S., but worldwide. Now, if you think about the 30 million people in the United States with diabetes, 1 out of 4 will develop a diabetic foot ulcer in their lifetime. So that's 25% of all diabetic patients will develop a foot ulcer. If we take that a step further, 25% of those who develop a foot ulcer will actually require an amputation.
Oh my goodness. So almost that would mean, if I did the math right, maybe 1/8 of the people who develop diabetes are going to lose their foot.
Yes, and more specifically, there are over 100,000 amputations performed in the United States alone in patients with diabetes.
Why is it? Why is it that diabetes affects the feet so much? I mean, we know that there are so many problems with diabetes. The eyes get affected some kind of way. The kidneys get affected. The heart gets affected. But you just sometimes can't, I think that people can't put the two together in the world out there, that something happens to the foot when you are a diabetic.
Let's take you through this process, and let's take your viewers through this process. When you have diabetes, what happens after years, you develop peripheral neuropathy. Peripheral neuropathy is damage to the nerves in the feet. And what that does, that opens the door. And what does that mean? When you have neuropathy, you lose sensation on the bottom of your foot. So where you and I could buy a new shoe and we'll develop a blister, we'll feel something tight, these patients with neuropathy cannot feel that. So what I say is they lose the gift of pain. Once they lose that gift of pain, they develop blisters, they develop sores, hence foot ulcers. They can't feel that there is a problem, so they don't know that something is wrong. And they delay their treatment. By the time they come see us, that foot ulcer is already infected, and then that infection is what leads to an amputation. So diabetes opens the door by developing neuropathy, and neuropathy is what leads to foot ulcers and subsequent amputations.
Okay, we are talking with none other than Dr. Alex Raiselman. I would say that I make no reservation that he is the foot physician for limb preservation. Stay tuned. We're right here on the Healthbeat Show. I'm Dr. Jeffrey Watson. We'll be right back.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
I guess sometimes things just happen. Devastating things. Your whole world changes in an instant. That's what happened to me the day my mother had a stroke.
I'm Paul George, and I want you to spot a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911.
Protect the ones you love.
Spot a stroke fast.
My name is Dr. Alex Raiselman. I'm a podiatric surgeon in the Bay Area. My expertise has been treating and managing diabetic foot ulcers and complications of diabetes in the lower extremity. I've been challenged with seeing many patients have no options over the years, and despite having the best efforts and despite providing all the resources we possibly could, we still couldn't find the appropriate cures and treatment. That led us to open Center for Clinical Research in 2003. Now 14 years we've been helping various companies develop new treatment and cures for diabetic foot ulcerations. Currently, we have several different trials going on in management of diabetic foot ulcers, diabetic peripheral neuropathy, and venous leg ulcers. If you're interested and would like to participate, please call 1-800-363-1069.
For advertising and sponsorship opportunities, log on to healthbeattv.info.
I'm Dr. Jeffrey Watson. For more information, go to our website, healthbeattv.info. You'll hear more about the information that we're giving you on the Healthbeat Show.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit.
Okay, I get it. I'll do better. Just please,
Don't leave. Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
We're back to the Healthbeat Show with Dr. Alex Raiselman. He is a professor of podiatric medicine at the University of California at San Francisco and also associate professor of medicine in the California School of Podiatric Medicine. Is that correct?
That's correct.
Your area is diabetes and preserving the feet. You know, I'll tell you, back, it was sometime in around 2009, I think, Medi-Cal stopped paying for Medi-Cal to pay for foot doctors. I had many patients with diabetes. You've described to us the fact that neuropathy, diabetes causes nerve damage. The nerve damage makes the foot numb. The numb foot then gets a sore. The sore then results in infection. Infection then results in losing the foot. I couldn't get a foot doctor to be able to take care of many of these patients. Many of the patients then had to get amputations because of this issue related to the insurance. What's your thought about that? Do you think that's a realistic correlation? I saw it firsthand in my office.
Well, you know, it's a devastating problem that occurred in 2009 when Medi-Cal took podiatry off their provider panel. We know that podiatrists save limbs, but I want to give you a statistic that has recently come out. In California alone, from 2010 to 2016, there's been an increase of 30% in amputations. That's in California alone. And of course, it varies from county to county.
Mm-hmm.
But that's a huge problem, and that correlates fairly well with when Medi-Cal stopped allowing podiatrists to take care of the foot.
You know, there was another statistic that you presented. You being a physician that is involved in limb preservation, when we were out, I was first meeting you, we were discussing the subject, I was intrigued listening to you. You even brought up the point before I could say it. It was going to be the next question out of my mouth. Minorities seem to be subjected to this at a higher rate than others. What's your thought about that? Why is that?
That's a great question. There's been a study recently that showed that if you're a minority and if you're a lower socioeconomic class, you're actually at higher risk of developing an amputation. Now, there are probably several reasons for that. I think that one of the reasons is patients don't do a good job of taking care of themselves. They're also probably afraid of coming to the doctor because they think that they're going to lose their leg, and hence the delay in treatment. But there's a huge problem in access to care. And even in California, even in the Bay Area, it's really hard to imagine that difference between saving a foot and losing a foot could mean going to hospital A or hospital B. So the care is quite different because of the access to care and probably the specialists that are interested in seeing this type of problem.
So it's a multifaceted situation. It may have to do with economics, it may have to do with access to care, it may have to do with fear of getting an amputation. And it is, I guess, either the orthopedist, which is a bone doctor, or the podiatrist, that when an amputation does occur, they're the ones that have to do it.
Yes, you're absolutely correct. For the most part, podiatrists are the ones that are on the forefront of the amputations because we get to see the foot complication. When the patient develops a foot ulcer or a wound, they're thinking it's a foot problem, we need to see a foot specialist. So podiatrists are the ones who are sort of gatekeepers. They get to see these patients first. And we always advocate that if you have diabetes, we want to see you. The sooner the better. Because the reality is that we can actually save and prevent amputations.
Prevention, that's the key. We're talking with Dr. Alex Raiselman. I make no reservation that he is the physician that is involved with limb preservation. Preservation, that's really what I want to talk about today. You know, it's kind of scary talking about these issues of losing your feet. We know that there seems to be a blood vessel issue involved too, a vascular issue. We know that you work with blood vessel doctors. What is it about diabetes that causes blood vessel problems to the feet?
Patients with diabetes are at a higher risk of developing PAD. PAD stands for peripheral arterial disease, or in other words, circulatory problems. Not only do patients without diabetes develop circulatory problems, but once you have diabetes, that increases your risk of developing circulation problems. So when you add diabetes and PAD together, that's a bad combination. I was fortunate enough in 2011 to come together with Dr. Michael Conti, who is the Chief of Vascular Surgery at UCSF, and together we co-direct the Center for Limb Preservation Service at UCSF. The idea is that if we can combine this multidisciplinary approach between podiatrists and vascular surgeons, we can prevent and treat and manage majority of these problems. And to a large extent, these problems are preventable.
Now you talk about a monumental institution, University of California, San Francisco, where I did my last year of training. Most people think of that as a high-level institution. It's an academic institution. It's where research occurs and where people who are professors like you are. do you have to have the highest level of insurance? We're talking about minorities who may end up with amputations. It may have to do with fear. It may have to do with financial issues. But here's a situation. I want people to have the opportunity to have limb preservation. I want them to not be afraid to go to someone like yourself who understands the process. At the program that you talk about that involves vascular surgery, involves podiatry, it involves the primary physicians who are going to work to help them with their diabetes. Can one access that now if they have Medi-Cal, which changed the situation several years ago? Can they access that if they maybe don't have good insurance?
So the answer is yes. At UCSF, at the Center for Limb Preservation, we're actually taking all comers. Whether you have great insurance or poor insurance or underinsured, we really do not say no. We try to see as many patients as we can because we want them to know that we're accessible. And we have patients coming from all over the Bay Area, as far as San Joaquin Valley, as far as Sacramento, various counties. So we want people to know we're there for them. We can help.
Now, you also have improved access by having clinics that aren't just at San Francisco, at the University of California, but they are local, some in the East Bay. Can you tell us a little bit about where those clinics are?
Yes, we're talking about Bay Area Foot Care. It's a podiatry group that was founded in 1998, and we have offices in Castro Valley, Dublin, Berkeley, San Francisco, Sacramento, and all of these offices are staffed with dedicated, well-trained podiatrists whose mission is to save limbs.
All right, we're talking with none other than Dr. Alex Raiselman. I make no reservation that he is the foot physician for limb preservation. We're talking about saving your feet today, right here on the Healthbeat Show. I'm Dr. Jeffrey Watson. Stay tuned. We'll be right back.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
I'm Dr. Jeffrey Watson. You're watching the Healthbeat Show. Stay tuned. We'll be right back after these very important messages.
When caring for a diabetic foot wound, every minute wasted could mean losing a part of your foot. To make matters worse, 50% of patients with a diabetic foot ulcer pass away within 5 years. To save a limb requires a team leading the way in medical research and advancement. For the past 14 years, that team at Center for Clinical Research has helped over 2,000 patients keep their limbs. Call or visit us online to learn about no-cost clinical trials, because time is tissue.
Hi, I'm Ashanti Altavis, and I'm here to tell you to watch the Healthbeat Show.
Well, Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. Big time.
And we're right back. I'm Dr. Jeffrey Watson, right here on the Healthbeat Show with Dr. Alex Raiselman. He is a podiatrist. He is a professor at the University of California, San Francisco School of Podiatric Medicine, along with the vascular surgery program where they partner to try to do care in helping people to save their limbs, limb preservation. Now, in this institution that you work with, University of California, San Francisco, one of the institutions, is helping to bring some of the newest things to the community. It also does research. It does clinical trials. And I would say this, I have some patients that I've sent to you. I'm not talking to someone that I have no idea. They have come back to me with samples of wound treatments, I mean big bags of it, that I know that their insurance wise wouldn't pay for it. They told me this themselves. They put it on, one of them was collagenase, they had strips, they had powders, they had other things. It actually seemed somewhat magical. They helped teach me on how to heal the foot. But tell us a little bit about the research, the clinical trials. How could patients get involved in this that would help them to heal their feet?
Well, I'm a firm believer in research. As you know, without research, there's no innovation. And fortunately, I've been able to perform research and get myself involved in clinical trials for the past 14 years. That's opened the doors for a lot of patients. A lot of patients who are interested in participating with new and advanced healing modalities, if you will. And over the last 14 years, we've helped bring forth various devices, procedures, products to help patients heal their wounds. Patients can come and participate, or they can come and see us without participating in the trial. But the trials offer them innovative approaches that are not currently on the market. Mm-hmm. And I think that's been really a nice resource to offer to these patients.
Mm-hmm. And it's, you know, again, we're talking about financial aspects of healthcare, the fact that you've got to overcome the issues of access. You have clinics that are all through the East Bay, Sacramento. You've got them in Castro Valley, Berkeley, the Oakland area, as well as in San Francisco. And clinical trials, tell us just a little bit. You said devices and other therapies. Tell us a little bit about how you can prevent somebody from losing their toes, their feet that have diabetic wounds and neuropathy.
So the most important thing for patients to understand is we need to see them as soon as possible. The earlier we get to see them, the better their chances. Mm-hmm. So if they come in with a wound, there are so many options that we can do. For example, the new innovative treatments could be human placenta products that we can apply to the wound, and these products have growth factors. They have living cells, which can jumpstart and orchestrate this healing cascade. Wow. That's one example. There are some growth factor therapy that can be done topically. There are some skin-like structures that can be applied that are biologically procured. And those are just a small sample of what's available. Mm-hmm. Now, in terms of prevention, if we can see every single diabetic patient and assess their foot, we can identify who's at low risk and who's at high risk for losing their foot. And at that point, we can then intervene. We have things like diabetic shoes, preventive shoes that you see here. But there's a lot of options available as long as we get to see these patients.
Mm-hmm. And so that's the key thing now. Do they have to be referred by a doctor, or can they just call you up and say, listen, I have diabetes, my doctor hasn't told me about you, I want to save my foot, I understand you guys are in the business of saving toes and feet. Can they call you direct, or do they have to be referred by their primary care physician?
They absolutely can call us directly. They can call our 1-800 number and we'll be able to get them in, and the beauty is we can get them in within 24 hours.
Okay, what is the 1-800 number?
It is 1-800-363-1069.
Say that one more time. I think that's so important.
1-800-363-1069.
Okay, so folks can call directly, access the Clinical Research Center or the clinics at UC San Francisco by calling that number. They can talk about diabetes, they can talk about their foot ulcers, they can talk about getting some special shoes, they can talk about getting in a clinical trial. Now, what if the people live far away and they needed to get transportation? Are there any incentives that might help them to get there? Any ways that you're able to assist them to get transportation or anything?
Now, frequently, we're able to help them with transportation. We just have to talk to them and find out what their needs are, and we're very willing to try to get them, whatever it takes, to get them help in order to prevent them from losing their foot.
All right, we're talking with Dr. Alex Raiselman. He is a professor at the University of California, San Francisco, Podiatric School of Medicine. He has done great extensive research in foot wounds, particularly foot wounds in diabetics, foot wounds that involve vasculature and that involve neuropathy, numbness of the feet. So that means the nerves and the blood vessels of the feet. Take us through, again, the last piece of how people end up losing their feet. Diabetes causes the neuropathy.
Diabetes, neuropathy, foot wound, infection, amputation. So somewhere along that line, along that pathway, we can intervene. And we can intervene where they have neuropathy, we can intervene where they have a foot ulcer, and even if they have an infection, we can still intervene. But if it's allowed to go on and fester, it's the delay of care that frequently leads to amputation.
Okay. I want to thank you, Dr. Raiselman, for being on the Healthbeat Show. We hope that you'll come back, that you'll talk to us more, that you'll give us maybe some public service announcements that can help us to think about this again, because I always say that if you knew better, you could do better. I'm Dr. Jeffrey Watson. Remember always that your health is your wealth, and when you have your health, you have everything. Thanks again, Dr. Raiselman.
Thank you.
All right. We'll see you next time. I'm Dr. Jeffrey Watson. Thanks for being with us on this episode of the Healthbeat Show, where we try to educate you about different aspects of healthcare, about eating right, exercising right, what you can do to help yourself, how to access the healthcare system, what kind of questions to ask, what you should do for any particular disease state. Because I always believe that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. We'll see you next time.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the Healthbeat you're gonna be. How do you wanna be? Show me how you will be. How do you wanna be? Show me how you will be. Listen to the show, the more you'll know about your health, soul, body and mind. 'Cause the more you know, your life will show you have a shining one point of view. You know